One of the skills you may be asked to perform when you take your state exam is to provide catheter care to a female resident who has an indwelling urinary catheter. Soap and water should be used for the catheter care. For testing purposes only, the cleansing of the front perineal area and catheter are evaluated. Cleansing of the rectal area and buttocks is not tested in this skill. A mannequin is used for the role of the resident client. The checkpoints the state evaluator will use to evaluate your performance are listed at the end of this video demonstration. Greet the client, address them by name, and introduce yourself. Explain the procedure by speaking clearly, slowly, and directly, maintaining face-to-face contact whenever possible, and ask client about personal preferences. Provide privacy with a curtain, screen, or door. Put on gloves before providing catheter care, cleaning equipment, and handling soiled underpads, washcloths, and towels. Position towel or underpad under buttocks and thigh area. Check to make sure water is of a safe temperature and comfort, and ask client to verify comfort of water. Expose area surrounding catheter while avoiding overexposure of client. Apply soap to wet washcloth. Without tugging catheter, clean the inside of the labia, wiping in only one direction from front to back, using a clean area of the washcloth for each stroke. While holding catheter at the meatus without tugging, clean at least 3 to 4 inches of catheter from the meatus, moving in only one direction away from the meatus, using a clean area of cloth for each stroke. Place soiled, soapy washcloth in soiled linen container and obtain a clean, soap-free, wet washcloth. Without tugging catheter, rinse the inside of the labia, wiping in only one direction from front to back, using a clean area of the cloth for each stroke. While holding catheter at the meatus without tugging, rinse at least 3 to 4 inches of catheter from the meatus, moving only in one direction away from the meatus, using a clean area of the cloth for each stroke. Place soiled, wet washcloth in soiled linen container and obtain a clean hand towel. Without tugging catheter, dry perineal area, wiping in only one direction from front to back, using a clean area of hand towel for each stroke. While holding catheter at meatus without tugging, dry at least 3 to 4 inches of catheter, moving away from meatus using a clean area of hand towel for each stroke. Place soiled hand towel in soiled linen container. Leave tubing free of kinks or obstructions and keep tubing and urinary drainage bag off floor throughout procedure. Keep urinary drainage bag positioned lower than the bladder throughout procedure. Remove towel or underpad from under buttocks and place in soiled linen container. Make sure the signaling device is within reach, client's comfort needs are met, and bed is in low position. Empty, rinse, and dry basin. After rinsing and drying basin, place basin in designated dirty supply area, dispose of trash, and make sure overbed table is clean and dry. Wash your hands before performing your next skill or at the end of your last skill. Skill checkpoints. Does the candidate greet resident, address by name, and introduce self? Provide explanations to resident about care before beginning and during care. Wear gloves while providing catheter care, cleansing equipment, and handling soiled underpads, washcloths, and towels. Position towel or underpad under buttocks thigh area before cleansing, and when care completed, remove towel or underpad or leave resident on a dry underpad. Use water of safe temperature for washing and rinsing. Use soapy washcloth to clean inside labia. Change spot on soapy washcloth for each washing stroke, wiping from front to back when cleansing inside labia. Cleanse catheter using clean area of washcloth, washing away from body and down the catheter at least 3 to 4 inches. Use clean, soap-free, wet washcloth to remove soap. Change spot on washcloth for each rinsing stroke, wiping front to back inside labia and away from body when rinsing catheter. Dry perineal area from front to back after completing cleansing and rinsing. Leave tubing free of kinks or obstructions and keep tubing and urinary drainage bag off floor. Keep urinary drainage bag positioned lower than bladder throughout procedure. Complete skill having rinsed, dried, and stored basin, placing soiled linens in hamper, disposing of trash, and leaving overbed table dry. Keep resident positioned a safe distance from the edge of the bed at all times. Ask resident about preferences during care. Use standard precautions and infection control measures when providing care. Ask resident about comfort or needs during care or before care completed. Promote residents' rights during care. Promote resident safety during care.